Welcome to my channel Medicine Handy Point. We have selected another important topic in medicine, which is pulmonary embolism and its management. Any patient presenting with shortness of breath and tachycardia, we have to suspect pulmonary embolism, and it has to be ruled out by doing well score for pulmonary embolism. Well score is a recognized scoring for pre-test probability. So in well score, we look for clinical sign and symptom of DVT, pulmonary embolism as the first diagnosis, tachycardia, immobilization, a prior DVT, hemoptysis, active malignancy. If the pulmonary embolism well score is more than 4, then it is likely pulmonary embolism. If the well score is less than 4, it's unlikely. So if the well score is 4, as we discussed, it is a likely pulmonary embolism, and then we have to arrange a CT pulmonary angiogram. If there is delay in arranging for CT pulmonary angiogram, then we have to start heparin to prevent the progression of the clot. If the well score is less than 4, then it is unlikely pulmonary embolism, and the next step is to do D dimers. If D dimers are negative, then it rule out pulmonary embolism. If D dimer are raised, then the next step is to do CT pulmonary angiogram. Even if there is delay in the CT pulmonary angiogram, then we can start heparin right away and while waiting for CT pulmonary angiogram. If CT pulmonary angiogram cannot be done due to allergy to the contrast or renal impairment, then we can do VQ scan. Now, the importance of D-dimer in pulmonary embolism, it has a sensitivity of 95 to 98%, but very poor specificity. So we cannot rely on just D-dimer. If D-dimer is negative, it has importance. It virtually ruled out pulmonary embolism. So it has importance in negative predictive value. D-dimer has no value in a pregnancy because in normal pregnancy, D-dimer will be raised. Now, pulmonary embolism uh, can be diagnosed by pulmonary angiography, which is a gold standard test, but it has a lot of complication and is rarely done these days. Now, diagnosis of pulmonary embolism will be challenging in the pregnancy because we will have some limitation in a pregnancy, and pregnancy is a prothrombotic condition. Pulmonary embolism is common. Pre-test probability should be done in suspected pulmonary embolism in pregnant patient. If the pretest probability is high, the next step is to check for the signs and symptoms of DVT. If there is unilateral limb swellings, we can proceed to Doppler studies. And if the Doppler study shows us that there is a clot, then we can start happening and we can proceed to chest x-ray and CTPA later on. In fact, we will depend on the situation and the condition of the patient. We may not do CT-TPA. If there are no signs and symptoms of DVT in lower limb, so we don't have to do then Doppler, just proceed to chest X-ray and CTPA directly. Now, the question is CTPA versus VQ scan in pregnancy. CTPA increases the risk of breast cancer by 13% in pregnancy because the breast tissue was sensitive to radiation during pregnancy. So there is 13% increase risk. VQ scan actually causes childhood malignancies in the childbirth. So during pregnancy, we can do half VQ scan can be done. Uh, Now the treatment is to start heparin with warfarin for pulmonary embolism. for 3 to 6 months, depending whether it's provoked or unprovoked. A pulmonary embolism with circulatory failure, there is likely massive pulmonary embolism, and we need thrombolytic in that condition. Thank you so much for watching.